My name is Dr. Taylor. I'm an ER doctor, and this is your public service announcement for the day. Now, I did not think as an ER doctor I would ever have to make this announcement, give this warning, or even talk about this. So what I'm holding is called a bug bite thing, and I'm going to put this on the screen for you just so you can see this a little bit closer. Bug bite thing, insect bite sting suction tool. Suction tool, all right? It says, helps alleviate itching and swelling from bug bites and stings. I had a patient place this on their clitoris because reportedly they had a splinter. Now, at first you may be like, wait, what? Typically after a bug bite or a sting, you place the device over the area. You're gonna pull both handles upwards until you feel suction. You're gonna hold it for about 10 to 20 seconds, and then you're gonna push down to release that suction. This is meant to be utilized on a relatively flat surface that is firm. It's really firm, and then you have the bug bite, all right? Because it's pushing against that firm surface. The clitoris is not just some simple structure like a bug bite. This mysterious erectile tissue houses thousands of nerve endings. In addition, on the screen, I'm gonna put a few structures within this mysterious erectile tissue that become damaged potentially, all right? Dorsal nerve. We have dorsal artery of the clitoris, superficial dorsal veins. We have deep dorsal vein and deep artery of the clitoris. Do you know what happens when you place an inappropriate suction device on this tissue? That tissue is going to get sucked up into the tubing and it's going to get stuck. Do you know what can happen when this device stays on for hours and hours and hours? You're going to get ischemia to the clitoris. Literally, the clitoris starts to develop necrosis and die. This is a similar concept called clitoral priapism. So according to the Western Journal of Emergency Medicine, clitoral priapism is a rare condition that is associated with an extended duration of clitoral erection due to local engorgement of clitoral tissue. It goes on to state there is no specific treatment regimen that has been proven to be effective. Yeah, that's because it's rare and we just don't see it. All right, so this device is $9.98 at Walmart or on Amazon. Now, you can find yourself in the ER seeing multiple different specialists with a bill, over $20,000 to $30,000 as we try to save your clitoris. Do you know what else you can get at Walmart for only $14.99 that won't give you clitoral ischemia? That's something called a suction clitoris stimulator vibrator for women with 10 modes. Do you know what'll not result in a $20,000 hospital bill? Going back to this device, it says on the back, what does it work on? Mosquitoes, bees, wasps, ants, and other biting insects. But this next part though, I think some patients are going to take this very literally. It says it also works great for removing splinters. I think the manufacturers should probably specify where these splinters could be. Are we talking splinters on the hands, the feet, the legs, the arms, or the clitoris? It says, we do not recommend using on the face or neck. Again, I think we should probably specify a little bit. Face, neck, or clitoris. We should probably add that in there. So when that mood is right and you're tempted to reach for that $9.98 bug bite suction device next to your bed, slide it aside and grab that $14.99 device instead. My name is Dr. Taylor, and this has been your public service announcement for the day.